Hi, Amanda. Welcome to the podcast.
Thank you for having me, Emma.
This is, I think, just going to be such an informative episode for a lot of people in terms of raising awareness, particularly for patients that may come in and need more accessibility. So I really appreciate your time tonight because I know you've probably had a day at work. Is that right?
Yes, actually, I guess over here today is MLK Day. So,
Ah,
it's not typically a holiday where we have off, but my daughters, they have daycare and they were closed, so I ended up taking the day off. I spent some time with them, but
oh,
it
good.
is a loaded day when you have three small kids under three.
I was going to say, may not be exactly a relaxing day off, but at least you're off the tools.
Yeah.
Well,
Yeah.
before we get started with all the really informative stuff to help our fellow peers and clinicians, I would love if you could tell us a little bit about your dental hygiene journey and what led you to the path of choosing dental hygiene.
It's a funny story. Dental hygiene was never in my radar, and I just, chose a career where I wanted to be in the healthcare,
Mm-hmm.
helping patients, and but it needed to be in a smaller environment with a one-on-one emphasis where you could focus on your patient and have a doctor and like more of a team environment as well, but
So
much
important.
smaller than a hospital setting and things like that. So I thought to myself, what about dental hygiene? Because I was going through a crossroad in my life. I was a massage therapist. I had graduated with a bachelor's in psychology.
Oh,
I
wow.
spent some time traveling and just, deciding eventually it'll come to me. And then I took
Mm.
dental hygiene and I have no idea why, but at first I thought it was a big mistake. I was like, I'm wasting my money. You know how hygiene
Mm.
school is. It is
Mm.
insanely crazy. The the workload, they make you feel like it's gonna be like that in the outside
Mm.
world,
Yeah.
but it's really not. Um, and to be honest with you, it ended up being a beautiful mistake because
Oh, I love
I
that.
now see the impact that I am making for the deaf and hard of hearing community,
Mm.
the work that I'm doing right now, and even just like a provider, patients see me and they're like, if this person can do the job, I don't see, how anybody else can do it. It's like one of those things, like it's like the smallest impact that you make on these
Mm.
people, and it should bring life forward. So it was like one of those like mistakes. It's like a beautiful mistake, but it just ended up working out so well. So
Yes,
I think in that sense, it should, I'm just happy to be here doing what I love.
I love that. It's a beautiful mistake, like serendipity, you know. You just weren't entirely sure, but then it all
Yeah.
worked itself out. Because you were a cheerleader at one point too, right?
Yes. I get cheer for the Philadelphia Eagles.
That's so cool.
That was a long, long time ago.
And look
Thank
at you
you.
now. That's
Yeah.
incredible.
Yeah. Thank you. Thank you. It's like, yeah. I'm just a
Eh,
very modest person, so if you hear me saying, okay, that's great.
like, all right, let's try that. And so, how was it like growing up profoundly deaf? Just so, you know, more of us in the community can understand what that could be like, so we could relate to a patient that was deaf or hard of hearing when they come into our practices. What was that like for you?
So growing up profoundly deaf, it's kind of a loaded question because, there's so many parts of my life where, I had hard days, I've had good days. I
Mm,
mean, it's just like everybody else, but I mean, I felt like my parents raised me well enough to make sure that you're your own person to, know that
That's
you
so
can
great.
succeed in life doing whatever you want to do. And it's just a matter of taking that extra step.
Mm,
It's going to be a challenge, but, you just have to take that extra step to jump over that challenge and, make it to do what you can do in life. And, I've had, my mom is probably the one person that helps me, and she, I think I have a lot to thank her for it. So bringing that to, I don't know, it's just a very, different, I don't know, it, it, it's more of like it's who you are. It's like your identity. It's who you
mm,
are as a person, and you know, everybody seems to think, oh, you have a disability, and but that doesn't make you disabled.
mm,
You have, even though disabled is not a bad word to say, but it's just that like people see you as different because you use speech, you don't use ASL, so
mm,
you're part of a real community, and you're in the gray area. So like it's not always black and white. So I've always had
mm.
that hard time growing up because I didn't really know where I belong. But now I see, I'm just a profoundly good person, but I'm me and you're you, and that's just how I see it. So, and I hopefully patients see that way too.
No, absolutely. I think you're a really great representation, Amanda, for everything that you do, all the advocacy that I see you're involved in, your non-profit. It's amazing. And I think you're just going to go from strength to strength. So just keep doing you. And it sounds like you had a wonderful support system growing up as well, and I can see the confidence in you in all the posts and the reels and the information out there, and I'm sure it's really inspiring to other hard of hearing and deaf out there, and especially those who may be wanting to maybe consider dental hygiene as well. Have you ever experienced people telling you dental hygiene would be difficult or it would be hard for you to find a job? How was that for you?
I had many people tell me, dental hygiene school wouldn't work out. That it wasn't the right career for you. It was very discouraging. And
Mm,
but it took me 3 years to get into the program because of how hard it is. They're only something clear that they can to, have it educated. But even so, I was bullied, by a professor, by a dentist, a
it's
clinician,
terrible.
like all these things, like somebody who is supposed to educate you and
Mm,
provide you the research to be a better hygienist did not do their job.
mm,
And for a long time, I cried. I didn't know if it was just me or, because I had a hearing loss. It was just
mm,
like all these kind of things, and it took a big mental toll, on my health because
mm,
it was just so, I don't even know how to put it into words. I was just like, I don't even know like if I'm doing the right thing because
mm.
they're being mean to me. Because there's a difference between being a difficult professor and somebody who's being mean to you. Two
I'm
different
sorry you
things.
went through
And
that.
yeah, it's just I mean, I know that I'm not the only one because if I had so many other deaf or hard of hearing students come through and tell me their professor, their advisor are doing the same thing. They're telling them that they're not going to get a job out there because of their hearing loss. And
It's terrible.
it makes me so mad because I know that that is not the case
Hmm.
for them out there. And I know that we can do better about that. And that's kind of how I started my nonprofit along the way. At first it started out as an idea, and then I started this nonprofit, seeing how things would, come along, and then it was just more of a, it just kind of grew from an idea into, providing scholarships, community resources, all kinds of things to help students thrive in school. And I don't want that for them, what I went through in school.
No, absolutely not.
To the student. And I don't think that's fair, because I think, if you're an educator, you should be helping the students, be the best hygienists they can be.
Yep, not tearing them down.
And I think it's important for everybody to have a good experience. And even though it's hard, it is hard for everybody, not just for me, like even for, for you. Was it hard for you?
Yes, absolutely. I definitely spent some nights crying myself to sleep, or studying for something, because I just felt overwhelmed with everything that was going on, and you second guess yourself, is this where I'm meant to be? Like, should I continue this? Absolutely. So it's terrible hearing that you went through that, and that there are educators out there who would treat their students like that, any student like that. It's absolutely terrible. But you're a testament. Look at you now. Look, you're thriving. You're a successful clinician, and now you're helping others do the same. So you should be really, really proud of yourself. And just continuing on from dental skills. You're welcome.
Thank you. Yeah. You gotta keep pushing.
Yeah, that's it. And continuing on with dental schools, what can dental schools or programs do to make learning better for people who are hard of hearing? What can they implement?
I firmly believe in getting support, asking them what they need, making sure that they go to the disability service at their program, at their school, and just to ask, what kind of accommodation that they can request that the school can provide. And, for me, instead of having like a stethoscope to listen to your blood pressure, I was able to use a automatic blood pressure cuff to replace that. So that was one of those options that I had. Nowadays we have ClearMac, we have live transcription.
Great.
It's amazing technology. So it's very important to ask your student, how can I support you in this program? What can I do for you? It's very important question to ask, not putting them down, telling them that they would never succeed, they're going to drop out, you name it. It's not going to help them.
No,
be
not
supportive.
At all. And I think that's one of the most simple things you can do, right? Like, if you haven't had experience before, just ask. They're probably happier that you ask and show the interest that, hey, they can feel that you want to help them. And so asking the question is probably just a great step to begin with, and then going on from there. And another thing that I saw that you've been posting about recently is continuing education not being as accessible as it should be. Even with my podcast, I was thinking today, I was like, I should probably upload this on my YouTube page as well and put captions on there. So that's another platform, where it will be accessible. So how can CE providers or dental professionals who provide CE make their webinars accessible?
I think it's tough, because I think closed captioning should be provided anyway across the board, because a lot of people benefit from closed captioning. Not just people with hearing loss, and many people don't realize that. So for instance, you want to check your platform, the platform that you use, and make sure that it has closed captioning enabled, like such as Zoom. Always make sure that you enable the closed captioning on your end. If you're the host, check your settings, turn that closed captioning on, because we can't access the closed captioning from our end. So it's very important to make sure that you guys have that option.
Right.
It should depend on your platform. Just always make sure that there's closed captioning provided.
That's great. Well, I even find that closed captioning like helps me. Like I always have subtitles on in movies. I'm one of those people that has this. I'm that that person who has subtitles on when I'm watching Netflix at home for myself. So yeah, hot tip, everyone: make sure on Zoom from your end that closed captioning is available. And so, Amanda, what are your recommendations for platforms that support closed captioning? Do you know of any?
I know that Google Hangouts had it.
Google
I know
Hangouts.
Microsoft Teams had it. I know Zoom, besides Zoom, Google Hangouts, Microsoft, what else is there? I know that sometimes if you're sharing your PowerPoint presentation, if you're using Microsoft, you can enable the captioning on that PowerPoint presentation and share the screen so that the closed captioning can come up as well. So that's another option, another hack,
handy.
if you will.
That's handy. So
Yeah,
Zoom,
that's
Microsoft
a few of the
Teams.
things that comes off the top of my head.
Noted. So that's Zoom, Google Hangouts, Microsoft Teams, and then enabling it in PowerPoint. Okay, noted.
Yes.
And also what I wanted to know for myself, and which I'm sure other dental professionals would like to know as well. So as a provider, what questions should we ask a deaf or hard of hearing patient to accommodate them during an appointment? Or what can we know so we can already make those changes maybe even before that patient comes through?
I think that people should be paying more attention to the medical history, such as putting if you have hearing loss or you get a hard of hearing, and that way we know if they have a mode of communication. So, for instance, if they mark deaf or hard of hearing on their medical history, we can say, okay, what's your mode of communication? And then they'll say, I read lips. If you can put down your mark, if you can, provide a clear mark, or write it down for me, or have live transcription available. That's one of those things. Or if they need an interpreter, you may want to reschedule them so that you can have an interpreter available next time. She's like one of those things. I think it's very important to acknowledge who they are on their medical history and then asking them their questions like, what is your mode of communication?
That's a good question to ask, because I've seen that on your Instagram as well in terms of communication and assumptions that have been made. So we'll get into that a little bit later. But as a provider, do you recommend learning basic dental ASL for these patients?
I do. I mean, it helps because it will brighten their day coming into the office. Honestly, like if sitting, it's a really nice gesture to have when somebody, for me, like if I'm sitting in a chair and, you're covered up with your mask and I don't know who you are as a person, and then you're trying to sign to me, I'm going to be like, oh my God, the person trying to communicate with me, like maybe, we can actually make this work. Like it's like one of those things,
going that extra step to building rapport.
Yes. Patient
Awesome.
economy. Yes.
Awesome. Now let's get into unpacking some Hearing loss myths. So like I mentioned there, I've seen a few things on your Instagram there that I think a lot of people listening may not have the best understanding of either. So we'll start with the first one. The first myth, hearing devices cure hearing loss. What have you got to say about that myth?
False. Hearing devices, hearing aids, cochlear implants do not cure hearing loss. They just help. It's a tool to help you hear. It's there to amplify the sound. It doesn't. No matter how much hearing loss you have, it's not going to cure your hearing loss.
Well, that's good to know because I think it was a long, long time ago. I remember someone, I think it was a healthcare provider, not in dentistry, but they said something like, oh no, they've got, an implant. So it's fine now. We don't need to do any of these other things, but you can't assume that now, right? Because, now we know that hearing devices don't cure hearing loss. So that's a good one to know. The second myth that I think is important to touch base on is that people with hearing loss or who are hard of hearing read Braille.
I would say true and false because there are deaf or hard of hearing people who are blind. They do have vision loss. Someone, for example, Usher syndrome is one of those that have like both blindness and hearing loss. So it's kind of like an in-between, but if you're only, I will tell you a funny story. I was in a restaurant and I was having trouble understanding the waiter. And I just wanted him to slow down for me. And he was like, oh, I'll be right back. He comes back with the Braille menu. And I was just kind of like, okay. No, I'll be good.
So it goes back to just ask, what is your mode of communication?
Yes, there you go.
Okay, the next myth is ASL diminishes language.
It does not. There are years and years of research that tells you, if a child learns ASL, it doesn't diminish the English language or whatever language ASL is American Sign Language. So for instance, if you're in Australia, it would be Auslan. But that, just food for fact, there's over 200 sign languages in the world.
Wow.
So ASL is American Sign Language. So, English, there's research that shows that it doesn't diminish language. It actually helps the language. So
that's good to know.
It's something I actually wish that I had learned earlier on because my parents did not know that I was deaf until about the age of 3. So I didn't have access to sound until, I had my first hearing aid. So that also put me behind on language. And I have what you call, it's something like delayed auditory or delayed speech processing, something. It got term, there's a term for it, but I don't really tell myself what that is because, it just happened to be delayed. And I took years of speech lessons, but I also knew ASL in various stages of my life. So, but yeah, it will definitely help.
There you go, guys. It not diminishes, it helps. And the final myth that I'd like you to unpack for us is those with hearing loss wear hearing devices at all times.
I that would be false. We don't wear them all the time. I honestly, when you wear hearing aids, cochlear implants, it gets very, very loud. Your brain gets really tired with something that we call listening fatigue. So what I like to do is turn my hearing aids off at lunch. So I'm taking a break for myself, self-care, if you will, and
Yes.
so that I can regroup, eat my lunch, and then, get back to work.
Well, that's good to know, because you'd think maybe they would be on all the time, but it's sort of like maybe having like contact lenses. If I keep them in too long, I need a break from them. My eyes get really dry. And if I get to a certain point in the day where I'm at work and I've had them in from, 7 o'clock in the morning, you need a break from them. So you can't, here's the tip, guys. Can't be assuming that they are in all the time. And that makes sense, right? That makes a lot of sense.
Yes.
And for someone listening to this, Amanda, who may be deaf or hard of hearing and maybe want to apply to dental hygiene, what is your message to them?
Go for it. We need more deaf or hard of hearing dental providers. If you want to go to dental school, if you want to go to hygiene school, if you want to be an assistant, just go for it, because we need more people to help us, because we need more of us out there, because there's not enough awareness that we can do the job. There's not enough awareness in the dentistry world for us to help the patient. So they need us.
Yes. And I guess it comes down to, oh no, you go.
It's okay. No, there's not, if you think about it, there's not enough deaf or hard of hearing patients, because they're not getting the access to care that they need, because they need that to help them out too as well. Very important.
Absolutely. Because that comes down to being inclusive as well. We talk about maybe different, backgrounds and ethnicities in dentistry. We also have to have, different people with, disabilities or deaf or hard of hearing in our industry as well, because they're the ones who know how to maybe best communicate with these, but then also educate other dental professionals, and goes further than that, other health professionals as well, educators as well need to, learn about that as well. So before we finish off, I would love to hear some more about that Deaf RDH Foundation and what, how that happened, what you guys are doing. I'd love to hear some more about that.
So so we went into lockdown with COVID, right? And I got out in the world. Everybody was covered up. Nobody was helping me, kicking off with their mask. Everybody was staying 6 feet away from each other. It was like a really, really tough world to be in as a deaf person. It wasn't very inclusive. And I thought about, with all that time off that we had, I thought about how I felt in hygiene school and how others might be feeling in this position. So I was kind of like, maybe I should start like a nonprofit to help students get into school, because we need more people like us. Like I said, I didn't think anything of it, but it's only been almost 3 years, and it just kind of like grew very slowly, but it's become more of a community. I mean, I'm getting like more students come out there, more students applying to school.
Great.
And yeah, I mean, now I raise, money to provide scholarships for deaf or hard of hearing students to, reach their goals of becoming a hygienist.
I saw that. That's incredible. How can someone apply for that?
You can go to my website, thatdeafeducation.org, and there's like a scholarship tab that you can go to. You can write, there's an essay that you write, and then the board members go through it together, and then we decide the best essay for it.
That's so great. That's awesome. And so because you're a non-for-profit, if someone wanted to donate or post about it, what's the best way that they can go about that?
If they want to post anything about it, feel free to share on social media, feel free to share an email. If you want to donate, there's a link on my website as well. I have a nonprofit Instagram page. You can donate on there as well. I'm all over the place.
I love it. I love it.
Excuse me.
No problems.
Thank you.
And if anyone had any questions, Amanda, and they wanted to reach out to you directly, what's the best way that they can reach you? And also, what are your social media handles?
So I am at that.deaf.girl on Instagram. And if you want to email me, you can email me thatdeafeducation@gmail.com. You can reach out to me on my website. I'm always available, and I try to respond as much as I can. So.
Yeah, you're really quick with your replies. I was like, oh, Amanda's replied already. Awesome. Well, Amanda, thank you so much for taking time out of your evening today. That was really, really informative, and I learned a lot. I learned a lot today, so thank you.
Thank you, Emma, for having me. So I appreciate it.
Well, until next time, thank you so much.
Thank you.
All right, I'll just hit stop here. It won't cut out of the meeting.